Hello, my name is Kerry Foss. I'm the National Community Engagement Lead for Live Up. I'm speaking to you today about promoting healthy ageing in Australia using a behaviour change model, marketing and community engagement. I'd like to begin by acknowledging the traditional custodians of the lands, skies and waters throughout Australia and pay my respects to elders past and present. My organisation, ILA, is a national not-for-profit organisation that is changing the way people think about ageing through a progressive initiative called Live Up. Launched in early 2022, Live Up is a free healthy ageing guide funded by the Australian Government Department of Health and Aged Care. Live Up's mission is to transform the way people in Australia and the aged care sector think about getting older and redefine what people are capable of as they age. Based on a wellness and reablement model, Live Up provides tailored and impartial information on healthy ageing, including assistive technology and local social connections. It helps older people to make informed choices that help maintain their independence for longer and delay entry into the aged care system. To achieve this, we set the ambitious goal of creating a societal shift away from the negative bias about ageing and a generational behaviour change towards people taking control of their ageing journey. A place-based community engagement strategy was created and scaled nationally, and a sophisticated marketing campaign was developed, combining the science of human behaviour with the creative challenge of persuading people to view the upside of ageing. At a glance, there are three key elements to Live Up: the Live Up website, the Live Up navigation service, and our community engagement. Each of these elements is integrated to provide a seamless introduction to Live Up in the best way that suits the consumer. Our behaviour change model was developed as a framework for long-lasting and sustainable behaviour change among Live Up's primary audience. By aligning the behaviour change model with marketing activities, Live Up is guiding people towards sustainable attitudinal change. Live Up's primary audience is non-Indigenous people aged 65 years and older and First Nations people aged 55 years and older. Through detailed research, the Live Up marketing team were able to recognise the issues, attitudes and barriers older people have toward ageing. This allowed us to truly understand what might motivate them to move through the behaviour change model. This research was also used to develop 6 primary audience personas. These personas were based on a person's willingness to make lifestyle changes and their level of age-related functional decline. Our comprehensive understanding of these personas, their barriers and motivations to change were used to develop key messaging for the marketing, navigation and community engagement teams. This behaviour change model was then expanded to include measurable calls to action that aligned with our primary and secondary audience. Live Up's secondary audience was identified as the people who influence the health outcomes and lifestyle choices of our primary audience of older people. This secondary audience was defined as 2 groups: the carers and family members of older people and the health professionals and service providers that work with them. These trusted sources were considered vital in helping us to reach older people and promote healthy ageing within their communities. Using a place-based approach to community engagement provided both challenges and opportunities for reaching and collaborating with our secondary audience. Using a place-based approach nationally, applied on a state, regional and local government level, was by necessity quite structured and methodical, but provided learnings and insights that helped further tailor Live Up and shape our opportunities for collaboration with different communities and with groups within the health and aged care sector. We use the internationally recognised IAP2 spectrum as the framework for our community engagement strategy and progressively work to increase levels of engagement with our secondary audience. Commencing with inform and consult, we progress to involve, and now much of our community engagement is resting in the collaborate space. So how do we know that our behaviour change model combined with innovative marketing and comprehensive community engagement has been successful in promoting healthy ageing in Australia? We're pleased to share these statistics that give an insight into the remarkable strides Live Up has taken in challenging negative stereotypes and empowering people to take control of their ageing journey. Live Up has reached over 3 million people across Australia via our website and social media channels and on-the-ground community engagement. Importantly, tangible actions have been taken by older people as well as their trusted sources, our secondary audience, to access information on healthy ageing, assistive technology, and local social connections, enabling them to make informed choices about their health and to maintain their independence as they age. The combined approach of behaviour change methodology, marketing and community engagement has had a significant impact on how the aged care sector approaches healthy ageing, placing a strong focus on preventive care and reducing reliance on aged care services. The recent launch of our Friends of Live Up initiative will deepen our work in partnership with a number of organisations that are strongly aligned with our Rethink Ageing messaging. Earlier this year, ILA commenced work on an outcomes measurement framework to build consistency of approach to understanding and measuring social outcomes. Our data gathering has included a range of tools, including primary audience and secondary audience surveys, interviews, and observational tools. This framework is helping us to further improve Live Up and to evidence its social impact aligned with our theory of change. The testimonials shown are examples of the impact we're seeking to validate. Challenges and learnings, there were plenty. We did a number of pieces of work in both co-design and research. This was particularly important in informing our approach to First Nations and multicultural communities. And despite the challenges of implementing place-based community engagement on a national scale, we learnt from communities right across Australia, metro, regional and remote. And this provided enormous insights and a vital feedback loop for Live Up. Wherever possible, we use data to inform and drive our decisions, often needing to process things somewhat manually when we didn't yet have the systems to cross-correlate what different program areas of Live Up were capturing. It's an ongoing piece of work, but again, vital. And measuring success. For Live Up, this is ultimately about behaviour change. Being clear about our behaviour change methodology in the beginning and tying everything back to this has been key to demonstrating the social outcomes we're achieving. Thank you. I hope you found this presentation useful. I'm very happy to answer any questions, so please do reach out. Thank you.